Evet, hepiniz tekrardan hoş geldiniz. Açılışı Türkçe yapacağım. Birazdan İngilizceye de geçerek Michael hocamızı da sizlere tanıtacağım. Ben Doktor Kader Eser. Birçoğunuz belki zaten bugüne kadar yaptığımız görüşmelerde tanışma şansı bulmuşsunuzdur veya zaten bazılarınız zaten öğrencilerimiz tanışmışızdır. Bilmeyenler için hızlıca bahsedeyim. Ben şu anda aktif olarak zaten doktorum, aynı zamanda Medcamp'te OET ve genel anlamda İngilizceyi geliştirme sürecinde doktorlara mentorluk desteği sağlıyorum. Bugünkü webinarımız Michael Hoca ile gerçekleşecek. Kendisi resmi bir OET interlokütörü, IELTS egzamineri ve aynı zamanda Boğaziçi'nde akademisyenlik yapmakta. Bugün de çok güzel bir konuya değineceğiz Michael Hoca ile. Speaking, OET Speaking ile ilgili konuşacağız. Speaking, OET'nin gerçekten zorlayıcı olan taraflarından birisi olabiliyor. Bugünkü konu aslında common pitfalls, zorlayıcı aslında böyle tuzaklar gibi çevirebileceğimiz kısımları speaking'in. Alright, I think I can now switch to English and introduce you, Michael, and start this webinar. I am very happy and excited to have this webinar with you and with our attendees tonight. I think it is a very good topic, the topic of today's webinar, common pitfalls of OET speaking. Because when it comes to speaking, it's always a bit, how to say, like, it makes us really excited when we have to speak in English, even though we have this education in English for years. And when it comes to speaking in a setting that requires professional knowledge, it makes it even harder. So yeah, without further ado, let me introduce you to Michael Askari. I've already done it in Turkish, but he is an OET interlocutor, an IELTS examiner, and now currently an instructor at Boğaziçi University. So Michael, it is now, I can give you the floor to introduce yourself or briefly start this webinar. Thank you.
Thank you very much, Kader, for nice introduction. Hi, everyone. Ladies, gentlemen, because I don't see you, but you can see me. This is a webinar mode, but I welcome you all to this session. I only know that merhaba, değerli hocalarım. Thank you very much for joining us. That much. But today we are going to have a fantastic session, hopefully, about the common errors. And let me just start it, and then we can go through it. But I can promise you that all of the things that I'm mentioning here are from the real examples. Thank you very much, and let's get it started. Welcome again, everyone. Today, we will be discussing key insights and strategies to improve performance in the OET speaking subtest. So is it visible, Kader? Because can you see the...
Yes,
okay.
it
All
is
right.
visible.
Let's begin by understanding the structure of the test and the essential skills to evaluate it. The OET speaking subtest is a profession-specific assessment conducted in the format of 2 role plays. It evaluates your ability to communicate effectively with patients or their relative in a healthcare setting. Beyond linguistic accuracy, it emphasizes clinical communication skills, which are essential for building rapport, gathering and delivering information, and addressing patients' concerns emphatically. There are 2 main categories of criteria assessed. One is linguistic skills, which includes pronunciation, fluency, grammar, vocabulary, and the ability to use language that is appropriate for the situation. The second one is clinical communication skills. These focus on relationship building, understanding the patient's perspective, providing a structure to the interaction, and gathering information and delivering it in an understandable manner. Achieving success in this subtest requires candidates to strike a balance between these 2 domains, linguistic and clinical. Let's now explore some of the common errors that candidates make and strategies to overcome them. By the way, I have to tell you that these mistakes or errors that I'm showing here as an example, they are not made up examples. They are real examples that I have actually recalled or took notes after the exam sessions that I had. So you can benefit from them, hopefully. Because most teachers say that these are the common mistakes, but they are real mistakes that happen, not common, not only common, but also real. That's the difference. Let's move on. Now let's look at the common clinical communication, which is about using insufficiently structured questions during the role play. This issue often stops the flow of interaction and can confuse the patients, leading to incomplete and unclear information. Here is an example. This is a real example, by the way. Somebody said, have you ever feel other symptoms like fever? Okay. This example shows the incorrect tense usage. You understand that immediately. Okay. But apart from that, the lack of clarity in eliciting is clear. To improve the candidates, to improve this error, candidates should focus on clarity and systematic questioning techniques. Structured questions can help the patient provide relevant and accurate response. Let's look at the corrected version, or let's say improved version. Here you should use the clear structure and the technique that helps get the response you want. Look at this one. Can you describe any symptoms such as fever, nausea, or vomiting? Okay. Here, not only you're using the correct grammar, but also you're actually using specific information that you're looking for. This version uses proper tense and includes clear examples of symptoms. So try to be as specific as possible. That really helps. All right. Let's look at another frequent clinical communication error, which is a limited exploration of the patient's medical history. This can result in missing crucial information if you're not really diving deeper into the history. And I'm going to show you an example that someone used, and I think most candidates use. Do you have other diseases? What's the problem with this one? This question is too broad and lacks the depth needed to gather meaningful information. To avoid this, it is essential to ask more specific and detailed follow-up questions that tailor to the condition that you are actually exploring on the card. Here is the more, let's say, specific one. If you want to be more specific to get the response that you want, and instead of saying, do you have other diseases, you can easily say, do you have any chronic illnesses such as diabetes or hypertension? Or have you experienced similar symptoms in the past? These can be, by the way, used in other cards as well when you are asking for the history of the patient. Once again, look at the correct version. Of course, you can use, instead of diabetes or hypertension, you can use other, let's say, conditions relevant to your role play card, but the structure is the same. Always remember, exploring a patient's history thoroughly and completely not only demonstrates professionalism, but also builds confidence in your ability as a healthcare provider. The next common error in clinical communication is failing to provide clear structure. This includes a lack of signposting and summarization, which can leave the patients confused or unsure about the next steps. Some candidates I've seen, they use this very well. They summarize, but some, like most, I can say most of candidates I have experienced, they don't do it. They jump from one topic to another. they don't have this clear connection. This can disrupt the flow of the conversation and make it harder for the patients to follow. To improve, use phrases that organizes the discussion logically. Here is an example. You can use something like this. First, let me explain the diagnosis, and then we'll discuss your treatment options. This is a very beautiful, let's say, phrase or sentence that you can use in most of the scenarios that you are actually using in your role play card, because it has signposts like first, we are doing this, second, or then, and then it gives us structure, a clear structure to follow. Another significant error candidates often make is failing to provide adequate assurance, reassurance, or clear explanation of diagnosis. Simply offering vague statements such as, it's not serious, because I've heard that, is not enough. It's not serious is not really that good of a explanation. And it doesn't address the patient's concerns properly. To improve, provide reassurance while offering a clear and concise explanation. And as a doctor, try to make it a habit. Based on the symptoms, you can actually provide some alternatives. And instead of saying it's not serious, you can say, based on your symptoms and examination, I believe this is a mild condition like poison ivy rash, which is not contagious and usually resolves within a month. Let me explain why. Just look at the difference. By the way, dear doctors, it's not serious was used by one of the candidates. Just simply said he said it's not serious and moved on. And another problem happened is that because he used a short sentence, he had more time at the end. He finished at let's say, the minute 4 instead of completing the 5 minutes talk. So this complete response instead of it's not serious is quite useful. And always remember, effective information delivery requires balancing empathy with clear professional explanations to build trust and lower patients' anxiety. Let's move on. When interacting with patients, a common error is dismissing their concerns. Some of you forget that still I'm playing the role, but I'm there as a patient. So you shouldn't ignore and kind of dismiss my concerns. Consider this poor example. So don't dismiss and try to pay attention. So I said something like, how do we know it's not meningitis? This was a role play card, by the way. Then I said, how do we know it's not meningitis? It is written in the card. And this is my concern. But the doctor said, I don't think so. And instead of, this really happened. So I said, how do you know it's not meningitis? And the doctor said, I don't think so. That's not a very good answer. Why? Because I'm worried and I want a reassurance. I want you to pay attention to me more than this. And you can probably say something like this. Meningitis usually includes symptoms like high fever and a stiff neck, which you don't have. This makes it less likely. And instead of saying, no, it's not that I'm a doctor, you are a patient. Okay. So the takeaway, always acknowledge and listen to patient concerns. And offering detailed and empathetic responses helps build trust and provides the patient with clarity they need. Let's go to another one. This one is common, mistake in linguistic aspect. So we finished with some clinical one. Now let's look at some linguistic ones. Of course, we have a lot more of them, but because we have a limited time, I I had to pick and choose some of the recent ones that I have encountered in my, let's say, room. Let's focus on a particular one here, which was about wrong use of tense. This happens a lot. For example, look at this one. Do you have feel? Here, this is, by the way, used by the candidate. And here it's like incorrect use of two verbs are not used here. Like, do you have feel? You can easily use do you feel nausea or vomiting? Have is not necessary. And I've seen this happen in maybe it's something related to Turkish language among Turkish speakers more than other people, other nationalities. Another one is missing articles. This is not that serious. However, you can avoid it. Some conditions are not countable, like rash. I believe that we have a poison ivy rash. Is not necessary. You can say, I believe that you have poison ivy rash instead of a rash. Because like I said, some nouns are not countable. So most of the actually diseases are not countable. You cannot say that. You cannot use a before them. So try to actually, in order to avoid these kind of errors, focus on using correct verb tense and make sure that you have the subject, you have the correct verb in order. Ensure that articles are and prepositions sometimes are used correctly, like verbs like deal with, cope with. So don't forget with or problem of, let's say. If there is a preposition, use them correctly. Another common linguistic error is the overuse of basic vocabulary. Actually, this is more related to vocabulary, but this is something that I have seen a lot. Like I said in the previous example, not serious. Don't overuse something basic like this. Instead of that, this condition, you can say this condition is mild or self-limiting. I actually have seen some people use them, like saying self-limiting or mild instead of serious. These strategies can help you if you really try to build some synonyms. So instead of basic, maybe you can, the strategy I ask my students to do is like record yourself and see what kind of words you use all the time. Like maybe you can think of when you are listening to your own recording, you can yourself find out some words, better words, let's say, or you can actually consult a dictionary to find variation alternatives. That helps your speech more understandable and clear. So let's move on. Let's now focus on two important aspects of linguistic performance, like pronunciation and fluency. This is, of course, both of them are important for ensuring clear and effective communication. There are some, I remember, by the way, there are more mispronounced words, but I didn't remember. The one that I remembered in the last exam that I conducted as an interlocutor, a teacher, like, a candidate said, kept saying hamstring instead of hamstring. So this is, of course, just an example, but I believe that you can consult dictionaries. Nowadays, we are lucky. We have online dictionaries that you can listen to, or, of course, join MedCamp, and we have a lot of Keder and me and my colleagues, we provide you a lot of feedback on pronouncing words clearly and correctly. Regarding fluency, I have seen a lot of him and ha, we call it. A lot of unnecessary pauses when you are talking. That makes the speech less clear. For example, you can say, Well, the condition, it's not serious. That's one way of saying something. But when you say, well, your condition is not serious and it is self-limiting, so you don't need to worry. That's a string of information that goes together with no pause, makes it easier for the listener. So they actually look for this fluency. Fluency is more not about speed. So it's not about how fast you speak. It's about how natural you speak, and you are whether you are actually easy to follow or not. Remember, fluency is not about, like I said, speaking fluently. Sorry, speaking quickly. Don't focus on speaking quickly. Don't force yourself. Don't rush. It's about maintaining this natural and a steady flow, while pronunciation ensures the message is clearly understood. Actually, pronunciation probably more important in this setting than fluency. But in order to practice them, there are some pointers I can give you. But if you have any other questions, at the end we have Q&A. You can ask more questions regarding any of these issues. So, like I said, practice medical terms, at least the basic ones, and also role plays. Sample role plays can help you a lot. Let's move on to another key aspect of this test. It is professional tone. It's important. Why? Because it demonstrates empathy and rapport. It can help you. One common error is focusing solely on the treatment and advice without really acknowledging the patient's concern or emotions. So some doctors just stick to their notes and read the notes without really listening to the interlocutor or patient. That is a mistake, and that costs you. And some people just jumped straight to treatment without addressing the patient's worry. This approach can make the patient feel unsupported or dismissed. Here is a better way. You can easily say, you can use emphatic language like, I understand this must be worrying for you, but let me explain why you don't need to worry. Expressions like this, you can take notes and, let's say, have like 20 expressions like this and use them appropriately to really give this feeling of comfort or support to your patient. Acknowledging patient's concern is important. Using phrases like this, it kind of helps them feel better. Like, I understand how you feel. I understand this might feel, how this might feel, or um, the sort of expressions can really be useful. Building rapport is one of the areas that is assessed. Another aspect of professional tone is patient education. Sometimes you instruct, and this happens a lot, and you need to know how to do it. A common error is giving incomplete or vague instructions which can confuse the patient or leave them unsure about how to proceed, what to do. For example, this happened in, again, the last interaction I had with a doctor. The doctor said, wash your clothes and it will resolve. Well, this advice is too brief and does not provide enough context or guidance. Here is a better version. To avoid further irritation, wash all clothing that may have come into contact with poison ivy and avoid scratching the rash. Look at the difference. The message is almost the same, but the context, the detail, the phrasing can help. And it actually makes the patient feel more taken care of. Effective patient education like this not only ensures compliance of the patient, but also improves the patient's confidence in your care. Like I said, building rapport is important. And in the OET speaking subtest, it is part of the clinical communication. A strong connection with the patient sets the stage. By the way, this is a review. This is a review of what we had in the last 3 live sessions. So I thought if you have missed it, we can just give you a little bit of what you have missed. If you haven't joined, you can see what things we discuss in our live sessions. Maybe it can give you a taste of what we are doing. So in one of the live sessions, we talked about building rapport. Like I said, the first thing you do, introduce yourself. Hello, I'm Dr. Kader Aser, or I'm Dr. Smith. Could I confirm your name, please? And instead of just quickly jumping into, okay, what brought you here, or what's your name? First, introduce your name. And then, of course, show that you are giving validation to or acknowledging the person by saying, it's nice to meet you. How can I help you today? Or what brought you here? Can you tell me in your own words what brought you here today? And always try to notice on the card whether it is your first time visiting this patient, or it is returning patient, or you already know this patient. If you already know, you say, hi, Mr. Singh, it's good to see you again. Or, hi, Mr. Singh, I can see from your case notes, or on your from my notes, that you are actually leaving the hospital today, or you're ready to be discharged today. These are very important, and that adds to your score. So building rapport is important, and it actually creates an effective stage for the next level. Another let's say session we had, I'm going to talk about it, was about understanding the patient's concerns. We talked about how it's important to echo the patient's problem. Sometimes try to understand it by echoing technique. If you remember, so the person says, I'm worried that this problem will continue. You say, oh, you're worried about this lasting longer than expected. Is that right? So by asking that person, you are echoing their concern, you're asking for validation, you show that you are listening to them. And you can always investigate by asking further question. You mentioned you are concerned about the pain. Could you tell me more? First, validate. First, say that I'm listening to you. You're worried. Okay. You mentioned you're concerned about the pain. Could you tell me more? And also you can, like I said, always acknowledge their feeling, validate it, and respond. If I say I have a problem, you should say, I understand this might be worrying for you. Let me explain what we can do. And always greet, confirm the identity, explore the symptoms, ensure patient's concerns are fully addressed. If you want to remember, like, repeat this over and over again in your practices. In live sessions, we have some practices, and people who joined, I think, benefited. Let's talk about the last live session we had. We talked about providing a structure, which is very important because it avoids information overload. We talked about chunking, breaking down like some people just keep going on, just talk about the treatment without any clear chunking. This is important. Break it down into digestible sections. Categorize them. Is it symptoms you are talking about right now? Is it diagnosis, or is it treatment? Which one are you talking about? So it should be also clear for me. Repetition and summary. This is something that I have to tell you. If you are giving anything like instruction, diagnosis, and something, try to, at the end of your, let's say, diagnosis, just summarize it and get a validation. How does it sound? How does this feel? It's about communication, guys. So it's not just you giving information. It's not about that. It's about communication. Let's say example. This is a good example of good structure. First, let me explain where you can give the injection. Next, the steps to administer it. Finally, potential side effects. So I'm telling the patients what I'm gonna do in 3 steps. Common problems with providing structure. People jump from topic to topic without really covering every topic. Like first, if you're asking about the history, complete that first. Don't jump to treatment or diagnosis before completing that section. Sharing too much detail at once. Again, use chunking, use signposting instead of giving the long explanation. I have come up with a simple formula for OET for you guys. Maybe you can benefit from it, and it's easy to remember. It is called get cash. Okay, so it's related to you. And what we do here is like, remember, get, G stands for greet them. Like we said, could I confirm your name, please? Hello, I'm Dr. Askari. Could I confirm your name? Something that I have to tell you, in Turkey, I've seen a lot of people make a mistake. After doctor, you either use a full name like Dr. Kader Askari, or you just use the last name. Do not use first name. Don't say I'm Dr. Kader. You can say I'm Kader, or I'm Dr. Askari, or I'm Dr. Kader Askari. This is something I think cultural or related to Turkish language. Explore it. Explore, if stands for explore. Can you tell me when this started, or can you tell me what brought you here? So explore why the person is here. Don't forget, exploration is always good. The next one, T, stands for teach. Provide clear step-by-step information. You are the doctor, you are the authority. Let's break it down. I mean, you can use these expressions. Let's break it down. First, we'll discuss the cause of this problem, then treatment options. How does that sound? Always, after everything you are saying, get the feeling of patient. After T, we have C. What does that stand for? Check. Like I said, summarize, ensure the patients understand. You should see if the patient is actually following you. So does that make sense? Do you have any questions so far? It's good. Always like every minute ask this. And the next one is A, acknowledge. Like we discussed, acknowledge whenever they are talking about their problem. I understand this is concerning. Let's work on this together. Or let's talk about this more. Let's explore this. And next one is R. What does that stand for? Reassure. Provide confidence by explaining the next steps. This is manageable. So don't worry, this is manageable. With rest and medication, you will feel better soon. Again, very good sentence. Next one. Engage. Invite the patient to share any remaining concern. If you don't ask me, because in my card and as an interlocutor, we have a lot of when asked. If you don't ask, I have no obligation to provide that information. So try to ask as many relevant questions as possible, especially invite the patient at every stage. Is there anything else you would like to discuss today? Something like this. This is general, but actually it can help you. So remember, get care and remember to use them. And whenever you are actually talking, let's move on to the key recommendations for today, and then we move on to Q&A. So use structured frameworks for history taking and delivering information. For this, you can refer to our videos and our live sessions. We have a lot more actually there. For each of these bullet points, we have some sessions. You have to join and get more. But you can also get a lot done by practicing. Most of you know the basic grammar. Most of you have some issues with some words pronunciation. Please take care of them by practicing and role-playing with other, let's say, candidates, if you have a chance. And try to have a empathetic communication, which requires you listening to patient and responding to their concerns. Rehearsing practicing role plays are very important. It helps you be more fluent because you know the structure. It's time for you to shoot your questions, and I am at your service if you need any help regarding any aspect of speaking.
That
That's
was
it.
lovely. Thank you so much,
Sure.
Michael. And the formula at the end, that was spot
Did you
on.
like it?
Yeah.
Yeah,
Yes.
okay.
I wish I could have known this before my OET exam. It
It's
could have
okay.
helped me a lot better. Okay.
Sure.
Now we can move on to the Q&A session, everyone. Türkçe'de söylemiş olayım. Sorularınızı şu an chatten ya da direkt Q&A kısmından bize iletebilirsiniz. Webinarda Michael hocamızın değindiği konularla ilgili, speaking ile ilgili. And meanwhile, I can ask a question.
Yeah. Let me tell you something that everybody asks me. Look, during that 3 minutes that you are taking notes, some of you are really reluctant to ask questions. You can ask questions, guys. Some of these candidates don't know how to pronounce. And then when they pronounce it during the role play, they mispronounce it. Why you're doing this? When there is an opportunity for you, there is no penalty, there is no punishment for you to ask me as an interlocutor, excuse me, how can I pronounce this word? You don't know. Ask so that when you are talking to me, you don't mispronounce. What is the problem? The problem is this. When you mispronounce it, I pronounce it correctly back to you. You get kind of like, I've seen this in candidates. They get shocked. Oh, what was that? And then because of this shock, they forget about their card. Don't do this. You can easily ask if, for example, sometimes you from your card you understand that this is not the first time. So you can say, excuse me, this is not my first time with you on this card. So what is your name? How can I address you? Then I say, I'm Michael, so you can address me Michael. Or what's your child name? So for example, if I'm the parents and there is a child involved, never ever you are talking to a child in a role plays. Of course, in your profession, you're always talking to the kids, but in role plays, you're not talking to children, you're talking to the parents. So uh, for example, you can ask me, what is your daughter's name or your child's name? I said Rosie or James, some made up name, and you can use that, write it down so that you kind of feel that it is real. The more realistic you feel, the better. So I already asked a question from myself and I answered this.
Well, it was a very good point because I think many candidates don't know that they can ask questions in that 3 minutes warm-up session.
Yeah. Yeah. I've seen very few people to use that 3 minutes effectively and ask me a question like, guys, you are the doctor, I'm patient there. So you are the authority. So don't feel like I'm taking the test. No, I'm just an interlocutor, I'm a patient. By the way, my joke always is like, this is when I see the doctors come in and they are all nervous and anxious. I say this is the first time that I see the doctors actually seeing me become nervous because it's always the opposite. I become nervous when I see a doctor.
Yeah, I knew that was coming.
Yeah. All right.
I was going to ask a question, meanwhile, by the way.
Mhm.
So, like many candidates struggle with managing their time during the speaking because there are a lot of tasks and they sometimes it is really stressful to, touch upon all of the tasks. So, like, what would you recommend to ensure they address all the prompts in an effective way?
Two things. One, don't worry so much about the time. In my experience, the cards are designed in a way that if you cover all of the bullet points correctly and in more like, don't cut them short, don't start with a short question, fully cover them, that would help you to cover 5 minutes. Second, you have the chance to look at the time. Don't miss that. Sometimes, I mean, I shouldn't do this, but I sometimes helped candidates for some reason. So I just say, look at the time. I mean, I don't say it, but I should. You're running out of time. So it means that get to the treatment before signing off. So your task is to cover all of those bullet points. But when you look at the time, it gives you a sense where you are. Okay, and if you had less time, go to keep those bullet points short. Do not force yourself. Don't force yourself to rush to bombard the patients with a lot of information. Instead, just give one for each of those bullet points, one or two good sentence, and ask, is that easy for you? How does that sound? Can you follow this? That's it. Don't be panicked, because usually we are trained. Yeah, I have sometimes given 30, 40 seconds more to the candidates because we are trained not to stop you. So if you are giving some explanation, further explanation, we have to wait until you finish your thought. If you finished early, but you have time, the good thing is that you have to summarize from the beginning, okay? Go back and summarize. There is nothing wrong with summarization, and it actually gains you some score because at the end of the day, this is a test of English. So they want you to talk more to show that you are able to really explain yourself, summarize the point, summarize the treatment, summarize the reason for visit. That helps you to go to the 5 minutes.
Yeah. All right. Any more questions coming from you? You can type in Turkish as well, or you can turn on your microphone and ask as well.
Yeah.
And I see one question. So what happens if I don't understand the patient's questions?
Oh, you're a doctor. Never forget this. Like I said, you are a doctor. So I'm sure in Turkish also you sometimes don't understand the patient. What do you do in Turkish? You ask for clarification.
Happens quite often.
Yeah, it happens a lot. I mean, it happens whenever I visit the doctor. The doctor doesn't understand me, so I have to complete. So I have to complete my thought or explain more, repeat myself. You don't lose a score by, this is called asking for clarification. It shows higher level of English. Actually, it is a good point for you. If you are asking for clarification by, sorry, I couldn't catch your point. Can you make it more clear? Can you explain more? Or could you please tell me more about the symptoms because you didn't catch anything? Like, did you say this? Or you said this? Am I right? You mentioned this. Is that correct? So ask for whether you heard correctly. If you didn't hear anything, like you really want want the patient to repeat, ask them to repeat. Sometimes I repeat what I said, but you still don't get it. This also happens. What should you do? Then you can actually go to your card and ask, what do you mean by this? Do you mean this? So connect it to your card, because sometimes maybe I say something that is not relevant to your card, and don't focus on those. Always collect the relevant information. Heather, you are muted. It happens.
Sorry.
Actually,
So
I can see the questions. Let me, somebody, Bear Sue. Hi, Beru. Sue is our student. So is there any template that we can follow? For example, first greeting, the history and diagnosis. Of course, there is a template. We haven't completed our live sessions. When we complete them at the end, there is a template for you to follow. But today, actually, I gave you a, let's say, some sort of keyword that you can remember and follow that structure. But there is a template for the card itself. You have to go. The good thing is that in the card also there is like first getting the reason for visit, uh, patient's history, diagnosis, treatment options, and closing. That's not very complicated. Sue, you can get the template. It's quite straightforward very soon. in our sessions. We will give you a template. In fact, it's a good idea, Kader, to work on a template. I mean, to have one session on practicing the template. That's my suggestion.
Yeah, of course. Why not? We are going to do more and more speaking role play sessions.
Yeah.
So one of
Yeah.
them could be just focusing on, I
Don't
think,
miss these live sessions. My recommendation is that these live sessions can help you to be in the mode of exam and kind of feel the anxiety, talk to interlocutor, talk to your friends and other candidates, and kind of be in the because some people don't practice at all. They come to the meeting and they kind of say, "Oh, I could do better, but I didn't have practice." Why not? You have time. You can join MidCamp and kind of we can help you.
exactly.
Yeah.
Oh,
Somebody says, can you give us advice about resources that we can use to improve our speaking skills about OET? The resources actually we have on our platform. We have a lot of videos and questions and some other resources, but I believe our team right now working on more providing you with more resources that you can practice. We are also thinking of building some interactive feature in our platform that can give you responses. But at the end of the day, even if you study the vocabulary, the structures, and everything, you need to practice them. And that practice happens when you are doing it with another candidate. Regarding the more resources, I'm sure you can talk to Kader and she can either ask us to provide you because we have a lot of resources. We are not sharing that, of course, because it's valuable asset. But if the demand is high, we can actually structure it and give it to you guys.
all right.
Yep,
Any more questions, everyone? Thank you, by the way, Michael.
sure.
All right. I think that's all.
Yeah,
Thank you very much for this webinar, and thank you all. Thank you to all the attendees. And yeah, it was the very first webinar with Michael, but won't be the last. So yeah,
I'm
if
looking forward. There
yes,
are lots we can discuss and practice on. I think live sessions are quite a good opportunity for those who want to really test themselves and get the feedback from an interlocutor. And all of the examples that I bring up, none of them are just from the textbook. They are from real interaction with candidates and doctors over the years, like 6 years of OET has given me a lot of insight into what works and what not. And I invite you guys to join and join more sessions, and then we can help you hopefully to get your desired score. I thank Kader for and other team members of MedCamp for running this session because I think it was quite useful, hopefully for the candidates. That's from me. Thank you very much, and I wish
all right.
everybody a good luck.
Yeah. Have a good night, everyone. Katıldığınız için teşekkür ederiz. Görüşmek üzere.